So we're going to get started, and I want to start by welcoming you all to this presentation. During the presentation, as I said, we've asked you to mute your microphones just so we can have clearer recording and everyone can hear the presentation. So any questions, enter that into the chat box and send it to us. And during the Q&A time at the end, we will try to answer those questions or with emails or follow up afterwards if we don't have time for that. You should have received in the 30 minutes before this session your handouts for the session, so you can take some notes. And if you we're just going to cover the hot topics today. So if you want more information, we've developed webinars, toolkits, workshops. You can see those online at gowanhealth.com as well as gowantraining.com, or just contact us at gowanhealth.com, and we would be happy to help you to find the information that you need. Just to let you know, we've had some exciting things going on in the past year that we've worked to push our workshops that we would have been in person into some online training workshops. So you can go to gowantraining.com and you can do our online cognitive demands analysis certificate program, our mental health and return to work program, complex accommodations in the workplace. We've got a working from home series for you or your employees. And we're about to launch again the psychological health and safety in the workplace program specific to COVID. So you'll see that coming on to our gowantraining.com store. So let's start. My name is Nancy Gowan, and over the past 30 years or over 30 years, I've been an occupational therapist, a certified disability management professional, and Gowan Consulting has been my home for the last 21 years. And we have worked with helping employees and employers work together through life's challenges. I'm an international speaker and trainer, and I've authored a book on Human Resources Guide to Managing Disability in the Workplace, and hope to, as I move through my career, send you some more information through more books. About Gowan Consulting, we are 21 years in business. We are across Canada, and we provide some services into the US. As occupational therapists, we're focused on functional ability and work, and our services include anything that improves the health and productivity of your staff, including ergonomics, accommodation, stay at work, return to work, mental health support, training, policy development, and workshops. Our saying is we make the complex simple for you, and we're trying to work together for your healthy business. So I'm going to start with a bit of a story. So in 2020, mid-March, what happened was we got locked down. And as we were locked down and that COVID started to hit so many sites across Canada, we started to look at what's happening, what's going on. And we maybe denied it for a bit. We said, this will be a couple of weeks and then we'll get back to normal. And then we started to realize that it started to drag on. So it got to April, May, June. We started to get a bit frustrated and angry. We maybe started to bargain and say, okay, all right, I'll look after myself and I'll stay at home. I'll spend more time with my family, but it's going to be over soon, right? And then we maybe found out that it's going to last a little bit longer, and that second wave started to happen, and we started to get sad and depressed. And then we kind of moved in and we thought, okay, well, maybe the vaccine's coming. We got a little hope. We're going to accept that this is kind of our new normal. We're going to have a new way of living. And then we maybe looked for some meaning in this, and we started to say, oh, well, maybe this just means I just needed a little rest, a little time with my family, a little get closer to what's really important. But we all went through these stages of grief and loss over the past year. And as this second wave hits and we get locked down again, we're going to go through those stages, and you and your employees are going to experience that anger again, that depression, that sadness. And maybe you'll find employees trying to figure out what's the most important thing in their lives as they work through this. So let's talk a bit about mental health, because when we surveyed you, you said that was important. Well, pre COVID, we know that mental health disorders were common in the workplace globally, that about 3 in 10 employees suffered from severe stress, anxiety, and depression. Over 300 million people of all ages suffer from depression. 1 in 4 people were affected with a mental disorder at some point in their life. And nearly 2/3 of people, because of the stigma of mental health and the lack of resources, never sought help from a health professional. And this was pre COVID. Our rates globally for depression and anxiety have increased 15 to 20% over the past decade. And one of the really sad stats is every 40 seconds, someone died through suicide. And so it is really important when we look at these stats pre COVID to understand that there is a significant economic loss related to mental health disorders. Between 2011 and 2030, over $16.3 trillion is spent. And that's comparable to heart disease, cardiovascular, cancer, chronic respiratory diseases, and diabetes. That's pre COVID. So, what's happened since then? Well, the studies we've reviewed have shown that women are experiencing significantly higher rates of moderate to severe anxiety than men. About a quarter of women versus 17% of men. And reports of loneliness were about 23.3% for women and 17% for men. And this is a CAMH 2020 study. And we know that we lost over 1 million jobs just in the first parts of COVID. And we see more being lost in the retail, the food services industries. There's so many loss of employment. So thank you to you and your employers to keeping your employees employed. We also look at the essential workers and the healthcare workers, and we see that they're experiencing more exposure and stress as this second wave of COVID climbs. And if we look at benefit claims, since 1961, there's been a change in where our focus should be. So in 1961, we were worried about those people who had heart attacks and neurological conditions. In 2011, we were worried about those strains and sprains and mental health. But in 2020, mental health has surpassed all types of benefit claims. And we still are concerned about musculoskeletal and, of course, your employees working in their home offices over their laptops. So, what are the pandemic concerns that you told us? So, we surveyed Canadian businesses in December, and we asked you a couple of questions. This survey, turns out, it included over 300,000 workers across Canada. What are the top 2 biggest challenges that your organization is currently facing while working that's affecting employee health and productivity? Almost 55% of you overwhelmingly said mental health of employees. 25 said health and safety risks about employees or family getting sick. And 23% said social isolation from the team. And then we said, what are you worried about in 2021? And what can you expect? 63% of you were concerned about the mental health of your employees and crisis fatigue of your workers was about 37%. You still were concerned about social isolation, and manage your mental health was on your radar. So let's talk about what we've seen. OCAL did a survey of 6,000 healthcare workers. And in 2020, they found that there was a total of 55% that had anxiety and 43% that had moderate depression as rated on those scales. And when their basic needs for protection, physical safety, their personal protective equipment, their infection control systems were shown dramatically, over 60% of respondents said that they were anxious about their safety. So it is really important to strengthen our infection control strategies and to be able to look at the fact that our basic safety is impacting our mental health. Some reports from Morneau-Chapelle showed that the mental health of our workers declined over 2020. That on a rating scale that looked at our mental health index and our feelings of being mentally well, in April we were at a minus 0.5%. But in November, those ratings went down to almost 3.5. The rates of anxiety increased from pre-pandemic, when the rates of anxiety were about 3% of employees. In October, the Mental Health Research Canada rated those at almost 22% of individuals who reported anxiety. And when we look at depression, pre-pandemic, it was about 5%. And in October, it was rated at over 10%. And how are we coping? Well, from a substance use perspective, CAMH found that about 25% people polled in November reported binge drinking in the previous week. This alarmed their hospital psychiatrists. And cannabis use increased, that around 30% of Canadians had reported increasing their consumption. And the most sad statistics of all is the suicide risk. Pre-pandemic, 2.5% of the population reported having suicidal thoughts. During CAMH's surveys, they showed that this had increased in October to almost 10%. This is not only a health and productivity issue, this is a life issue, and we need to help our employees to be supported in the workplace. And we're going in, or heavy into, this second wave. And what do we do to help to keep our employees healthy in 2021? Because we're worried about that crisis fatigue. And crisis fatigue, you've heard about probably compassion fatigue, but crisis fatigue is similar. That after or during a long crisis, we start to feel emotionally drained. We feel like that hopeless, helpless feeling. And it results in our inability to listen to others' concerns, to cope on a day-to-day basis, and to be healthy and productive in the workplace. We're burning out, and it's time to be able to look at what we can do to support employees. And if that doesn't scare you enough, what's the cost? So when we look at this slide, it talks about the cost of doing nothing about psychological health and safety in the workplace. And we took a typical organization of about 2,000 employees. You might have less, you might have more. But when we looked at that, we said that, okay, the average sick days per year were 9.66 days per year per employee. We took an average hourly rate of 177.20 per day. And what we found, that the absenteeism, direct cost of benefit for short-term, not including long-term disability benefits, was about $3 million. And then there were intangible factors around psychological health in the workplace. So there's the chronic strain, the people that chronically have health conditions, episodic conditions. We average that, according to the research, to be about 1,700 per employee per year. And that about 20% of employees come in with chronic aches, sprains, strains, mental strain. And so that costs about $680,000. We also have employees under discipline for investigations around harassment and violence. And the cost of discipline, internal investigations, costs about $180,000. The cost of people just gossiping, complaining, we noted that about 60% of the workplace spends about 3 hours per week complaining. And that costs about $80,000. And then perceptions of bullying, distractions, and stress, that's about 1.9 million. The time spent on complaints, about 700,000. But the biggest increase that we've seen is the presenteeism factor. Prior to COVID, this was about 1.7 million. Since COVID has started, the research has shown us that 64% of your employees self-report that they're giving about 70% or less of their best effort every day. Because of distress, childcare, elder care, trying to be teachers at the side of their desk, trying to work in environments that are difficult because of ergonomics, because of not having access to the technology. So if we rate that 64% of those employees are losing about 30% productivity because of the COVID presenteeism issues, that employer at 2,000 employees is losing $24.8 million. So the cost of doing nothing on mental health is costing you $37.8 million if you have 2,000 employees. So what do we do? So let's go to the more positive. There are things that we can do. So I'm going to give you about 12 different strategies for 2021 to be able to help your employees in their mental health, physical health, and productivity. 1, focus on developing a strong psychological health and safety program. If you haven't looked at the Canadian psychological health and safety in the workplace standards, this is the time to tackle that. We want workplaces that are strong because we know that that investment will lead to you getting an investment of $2.6 for every dollar you spend. That's from a Deloitte 2018 study. Secondly, you want to prepare your managers for 2021. Do they know how to help employees who are uncertain, dealing with that loss of normalcy, coping with change, working virtually? You need to teach them to expect different reactions, to have good conversations, to stay connected, to discuss expectations openly, and to listen well. Listening with empathy, attention, and respect is so important right now, and we all are vulnerable. The one thing COVID has done is it has brought us to a level playing field that we don't know necessarily how to get through this unless we get through this together. So teaching managers on how to have those good conversations is one of the crucial things that you can do to be able to support your employees right now. And we have a virtual manager training program that we've upped our ante and we're running this on a monthly basis over the next 8 months openly for those who want to attend. But we've also had a lot of proactive organizations who have joined us in setting up customized manager mental health training programs for their managers to be able to look after the manager's mental health as well as the employee's mental health. So contact us to get more information on our manager mental health program. The third thing you want to do is you want to develop everyone's resiliency. And resiliency doesn't mean that everything is going to be rainbows and unicorns and roses, but resiliency is about helping people to get the practical skills and strategies to be able to cope when things like what we're going through right now hit us off our balance. How to get back on that balance and how to be able to look after ourselves through this process. There are 5 different types of resiliency muscles that we can build. So there are strategies and lots of tools. And maybe there's something that really triggers that employee to be able to find the right tool to help them. But it's an individual quest to become more resilient and to get the self-care that they need. And so we've given you in your toolkit some helpful resources, some strategies. You've got your employee and family assistance program if you're with an organization that has that tool, but the wait lists are high. You've got health and safety teams and HR that I'm sure are strategizing around mental health for employees. We've got some free online government-funded resources like Ability CBT, Beacon, Bounce Back, Big White Wall. And you can go to the Government of Canada website and look up COVID, and they will show you the mental health resources that are available free to your employees. We've also done virtual coaching sessions with our occupational therapists, where we have provided support individually to employees to find the right self-care and resiliency plan for them. We've got our happiness challenge that you can join at gowantraining.com, and a number of toolkits on our website to be able to help you and your managers and employees through this process. And what we've seen over 2020, that the EAP and benefits programs have been challenged by the increase in mental health. There's wait lists for employee assistance programs. They're not able to be accessed as quickly. And so there's a need for more creative mental health resources. And there's economic barriers to benefits. What we've been seeing is your employees may be able to access the benefits, but they need to pay it out to be able to get it paid back, or they're paying 20%. And that right now is a lot for them, especially if their partner is not working and they're having other economic challenges. And for you, there's cost for you to pay that additional administrative fee for those benefits that maybe only covers a few psychological visits. The average cost of a psychology visit is $200. So we need to look at how do we focus on prevention, get the resources into your employees. And we'd like to present that occupational therapists are an ideal mental health professional to help you in that area. We have the knowledge of your workplace, how to modify the jobs or the environment to help employees develop personal strategies. We're not just talk therapists, but we are activity-based. We're learning coping strategies and skills, helping that employee to be empowered to find the right way to improve their function and their productivity, giving them the tools, being work-focused in our cognitive behavioral therapy, which is an evidence-based approach to ensuring that employees can receive better self-care and resiliency. And we want to share that we've had the opportunity to provide occupational therapy coaching, both virtually and on site, to an employer in the past couple of years. And we found that this is a great preventative strategy that gives access to employees to occupational therapists on site. The organization that we worked with had 780 employees. The occupational therapists worked on site and virtually to coach about 164 of those employees. And on average, it took about 7 sessions, some only 1 session, some a few more. But on average, 7 sessions per employee. And we even were asked to develop a cognitive behavioral therapy support group for a number of employees going through the struggles of COVID. Because of the ease of access, because of the ability and the support that that employer gave, and the tools provided by the therapist with that employee working together to empower that employee to improve their function, none of those employees lost time from work. So we believe that it's better to be proactive and give that access on site to your employees to help them to stay at work. We also have developed a program that is our TIPS program for those employees who are going back into the workplace and feeling anxious, working through, staying at work through their anxiety. And this program is a 4-session plus 1 booster session program with the occupational therapists. It focuses on dealing with that worry and anxiety, doing some cognitive behavioral work to figure out why we're so worried about what's happening and strategies to integrate, to prepare and plan and get the services that they need, and to have stay at work tools and strategies. So this program is focused on supporting your employees with anxiety, about reintegration, or about staying at work for those employees that still need to be customers facing, that they're essential services, that this is a way to be able to help to work through some of that anxiety. The 5th strategy we recommend is to reduce the impacts of isolation. We're locked in and we're locked home. And our perceptions of social isolation or loneliness increase that threat of heightened feelings of vulnerability, increase our anxiety, and cause us to have an increased use of health risks, like we're smoking more, 15 cigarettes a day, having alcohol use disorders. Loneliness and social isolation are twice as harmful to the physical and mental health of your employees as obesity. So you want to take a look at those employees that you work with that are already isolated. They don't have family around them, even that they are home. They don't have connections. Those that are experiencing increased mental health challenges. And help those employees to be able to have the connection, deal with the pandemic, be able to have more strategies to stay socially connected, because their risk for suicide is higher now than ever. So keep connected. At work, have you developed regular check-ins with your coworkers that might be working virtually? Work towards those water cooler talks, those strategies that let that employee know that that you care, checking in to see if they're okay. Have they been encouraged to use kind of some of the technology to do virtual hangouts with their friends and family? Virtual fitness buddies or online programs are all great ways to stay connected. But one of the things that you can do as an employer is to ensure that they know what strategies that they can use, but that their manager also makes a concerted effort to stay connected. Not just about the work stuff, but about fun. I've had a lot of manager mental health training. It's been really exciting to see the great strategies that many employers, many managers have put together to keep their employees connected during this time. The 7th strategy is to help employees maintain their home and work responsibilities. So we've saw that presenteeism is hard. If we're working in the corner of our condo, in the corner of our home, and we've lost routine, we've lost that ability to have some boundary setting. Research has showed us that people are putting in more hours now that they're working from home because that's available. the computer's there, the cell phone's there. So assist your employees with developing a routine, having strict time management schedules, time blocking, setting some boundaries like asking for help, knowing when they can say no, prioritizing their work. Even ones like the end of the day comes, how do I formally have a way to shut down my office and go home if I'm always at home? So what's my boundaries? Shut off my computer, shut off my cell phone. What is the boundaries you're helping them with so that they can maintain that work-life balance? Some employees have been as creative as taping off their work area and their office area. Others have, at the beginning of the day, gone out one door, come in the other door and said, now I'm at work, gone out one door, come in the other door, now I'm at home. So that you actually have that boundary setting. You have that the decompression time between work and home. So have some transitional things that can be helpful for those employees. And of course, we want to talk about ensuring that your employees' workstations are ergonomic and that they have habits in place to protect their ergonomics. In the office, you've spent all kinds of money on getting the right workstations. Now they've gone home with laptops and they're working over their laptops on couches, dining room tables, side of their bed. These ergonomic changes are causing employees to have greater aches and pains. And what we've seen is in the first little while, we were okay. And actually, it was kind of good to be home and I could work anywhere. But we've seen the employees that we've worked with have greater aches and pains. And they now have barriers to getting the right health care. There's wait lines for physiotherapy. There's wait lines for chiropractics. At the earlier stages of COVID, those processes or those healthcare supports were closed down, and the backlog of healthcare has caused employees to not get the care that they need. And so we want to make sure that you're helping employees to have a good virtual ergonomic assessment. The ability to know how to make good decisions. Now, many of you as employers have set up policies to say you have this amount of money to be able to purchase an ergonomic workstation. And what we see is employees are making the wrong decisions. That the ergonomic decisions that they're making, unfortunately, are making things worse. So help your employees to make good decisions with a virtual ergonomic assessment. We can provide that in a quick way, in a supportive way to help that employee to know how to set up their workstation. Even if it's using board games and all kinds of things that are creative to set up their workstation, we want to make sure they know the key principles. So have you done that? And we've just heard that CRA has approved work from home expenses up to $400 without having employees having to have a T2200 from their employers. They've simplified the process. So maybe there's additional funds there that employee can put towards their good ergonomics, along with what you've contributed for their workspace. In order to help employees with all of these areas of work from home, we've created a work from home series. Now, the first is an online series that can be purchased for $150 by employees to be able to get 6 videos to help with all of those areas we've talked about, with worry and uncertainty, with being able to reduce isolation, making remote feel normal, helping to be able to have proper ergonomics, and to be able to focus on self-care and resiliency. If you want access to those videos for all your employees to be able to place it onto your learning system so any of your employees can have access, we've put it together in a really good package of $2,500 so that those employees can all have access to that information and that you can have those services quickly. We've also put together live sessions. So you'll see that we'll be promoting over the next little while. Our live sessions are making remote feel normal, setting up your home office ergonomics, and mental health resiliency and stress management. So we call it our February Fresh Start 2021. And so it's an opportunity for you to be able to have your employees participate in those sessions and get more information about how they can stay well at home. And you also want, for number 9, to create a good work from home policy. A good work from home policy sets expectations for your employees on when they need to be available, what their hours of work are, their breaks. You want to look at guidelines required to how many hours of work are going to be tracked. Will overtime be approved? Expectations for work and productivity and engagement. You want to be clear on how much you're expecting from your employees. Privacy legislation. When we're working from home in the middle of the corner of the house or the condo or the apartment, how do they maintain that privacy? And what is their expectation from you as a company to use equipment or devices? You might also set other expectations. When you're on a Zoom call, wear pants. I don't know. But make sure that you have a home policy that clearly outlines those kinds of things that they may need to consider. Confidentiality obligations, health and safety, like your ergonomics, what equipment are you purchasing, how much money do they have, does that become theirs or does it go back to the office? And if someone needs accommodation, how can they request that accommodation from their work from home? Because as you know, with health and productivity, you want to pay attention to those individuals that are struggling and how they can best do the essential duties of their job. And so our 10th strategy is provide accommodations. 2020 was a harrowing year, a year that was not normal. And 2021 might be the same until we get everything through. But what we saw is questions about, can I mandate that employee wearing a mask? Can I mandate if they have to get a vaccination before they come into the office? How do I keep them physically distancing when they are in the office? Can I mandate that they get a COVID test before they come back? And I've included in this presentation a few of those decisions that have come from arbitrators on that. But what I want to remind you is if an employee is pushing back on any of these areas, if it's because of a health or a disability issue, you want to have a clear accommodation assessment. And so the accommodations assessments that we have done with individuals wearing masks who had anxiety around wearing masks, we have been able to show that with the right desensitization process, the right supports, that employee has been successful in being able to wear the mask. We can do the same with these other areas because we need to consider that accommodation is going to be individual depending on what that person is dealing with on the day-to-day basis. Many organizations have also developed policies, processes, and procedures for things like mask wearing, vaccinations, physical distancing, COVID testing. And so if you are mandating anything or you are wanting to have these carried out, make sure that you have strong policies and procedures around this. And when someone does indicate that they're struggling with it, get a good accommodation assessment, and we can help you with that. So here's a couple of arbitrations that have come out that I'm sure you've probably seen, but I'll just remind you about the importance of having good, solid policies and procedures. So in this situation, an employee of Garda Security Screening worked at the airport, and the employee found out that they had been close to someone who had COVID. Their policy said that they needed to have a COVID test, wait for the results, and self-isolate. Unfortunately, the employee didn't self-isolate and was terminated. And you might think that that was really a strict decision. But the arbitrator agreed with that termination because of the solidness of their policies and procedures on this process. They were able to enforce what they said. And because of the seriousness of COVID, the arbitrator did support the dismissal of this employee. So when they say lockdown, we got to lock down. We've got to make sure that our employees know the importance. But as an employer, having a good policy will help you in this area. A recent arbitration around COVID testing. Can I make people get COVID tested? This came from a Crescent Care Nursing and Retirement Home, where the union filed a group grievance about bi-weekly COVID testing for their staff. The arbitrator dismissed the grievance. They said the policy is reasonable, that the privacy intrusion of having a COVID test was outweighed by the highly infectious and often deadly for the elderly condition, which was COVID, and concluded that this intrusiveness of testing was reasonable based on the work that the employees were doing. So this might be different for you. If your work is not with the elderly, it's not in healthcare, it's not in all those settings, but it is important to take a look at your policies and ensure that you're weighting that with the seriousness of COVID. And our 11th strategy is make a referral. Call us we can help you to customize a solution to be able to help you be supported for your health and productivity. We have the ability to help you with accommodations, stay at work planning, virtual ergonomics, mental health support and training, manager mental health training, and so much more. Our occupational therapists are waiting to be able to help and support you through 2021 to help you and your employees get through this well. And of course, I know I'm old, but we got to get social. So your 12th strategy is get social with us. We are sending out regular newsletters and blogs to help you in this situation. We're hopeful that you have been on our list and got our newsletters. But if you aren't, go to gowanhealth.com and get signed up for our blog. Get signed up for our newsletter. Sign up for our constant contact newsletter that goes out weekly with information. And get on our social media. We send out some great strategies and tools. Our Tuesday tips, hopefully you've been familiar with our Tuesday tips. They're still going out to you to be able to help you to have the information for you and your employees to be supported. And we're continuing to work on additional strategies and tools to help you through this process. So one of the things that we are working on is we are working on a membership program for you to be able to have the tools that you need at your fingertips so that you're not searching around for them, but that you can use evidence-based tools that we have available for you. So watch for that in the social media, watch for that in your newsletter, but get signed up so we can keep you informed. So that was my whirlwind tour, and I think we'll go to questions. So let me see. Now, is there any questions that we have for this? I'm going to allow everybody, and this is my technology capabilities. I'm going to allow everybody to unmute yourself. And so does anybody have a question about the research that I've given, the ideas or the strategies? Catherine's asking, can I speak more about the term crisis fatigue? Okay, so crisis fatigue is similar to compassion fatigue, and we've seen the crisis fatigue come from things like when Fort McMurray went through the fires. The research was showing us that as they were going through those fires, they were going through that crisis, moving out, losing their belongings, all of those things. What we found was that individuals who went through that type of a crisis had trauma responses, so that they not only got burnt out, but they experienced secondary trauma from those that experience. And we saw post-traumatic stress rates increase for the individuals that were involved in the Fort McMurray fire. We expect from COVID that we are also going to experience increases in post-traumatic stress, secondary trauma, and burnout. So crisis fatigue is a term that is used when we have significant crisis that infects a number of individuals and they're experiencing that over a long period of time. The normal response for our bodies is to stay revved up during that crisis, that we stay in that adrenaline focus, that high adrenaline. Our bodies continue to rev. And through that crisis, that eventually what happens is we get the experience of kind of a hopeless, helpless, and emotional response, and potentially burnout and post-traumatic stress. So it is something that is being monitored, and it's a new term that is being seen in the literature as we go through this global pandemic. Does that help, Catherine? Okay. All right. Any other questions? Thoughts? The recording, we will have recorded this, and so we hope that we can provide a recording to as many people as possible through our process, but let us know if you don't receive it. So I have a question. It says, as an employee, how do I suggest to my employer to develop a work from home policy? I'm not sure who your employer is, but I guess what I would say to them is I have a lot of questions about working from home and what is it that I can do? What are my guidelines in terms of working from home? And you may be able to take them this presentation. You can talk to them to say that many employers have formal work from home policies. I'm wondering if that's something that we can get clarity on through a policy statement or a procedure. I see that you work for a school board, so depending on your role, depending on what you're doing, I think it is very realistic for you to go to your employer, go to your human resources team and say, do we have a work from home policy? Can I get clarity on these things so that, and the list that I gave you is a list of recommended things to have involved in it. So hand them that and see if they can answer those questions for you, either through procedure or policy. I know in some school boards it does take some time to actually get policies approved, especially with our lockdowns and everything like that. So it may be that you just get clear answers on each of those areas that you have questions about, and that will lead them to develop a work from home policy. Any other questions? Okay. Well, then I'd like to just let you know that we are here to support you. We really do know that this is a difficult time for you and your employees. We're all working through this together. We're all pretty vulnerable. And there's some days that I could sit in bed myself, that every one of us are experiencing the same. And the one thing that I love about COVID, and sorry, I don't love COVID, but the one thing I love about the pandemic is it has leveled the playing field for everyone, that all of us are dealing with the concerns and worries and anxiousness of what's happening in the world, feeling like we're out of control. And so we've worked for years with individuals with anxiety and with depression, and no one's really understood what they're feeling. And I think one of the things that we've been thankful for pandemic about is that more of us are seeing how that impacts us, so that we can be more compassionate, more supportive, more loving and kind of each other, and just being able to give people that time, that support, and that togetherness that we're in together. And as we get through this, we will support each other, work towards having better strategies for our workplaces, so that we can take that back in our new normal to have respectful, civil, compassionate, and supportive workplaces for all our employees. And so if you want more information, here's our information. Our Gowan Health at gowanhealth.com is your best email. Give us a call. We are all working from home lockdown, but we're still here for you. We still will answer your calls. It might take a little bit longer as we get adjusted again. Follow us on social media. Ask us for support. We'd love to just have a quick consult with you to say, what can we do to help? We're here for you. And I thank you for spending the last hour with me and being so quiet. I know I got to use this for my kids, just shut them on mute. No, just kidding. It's been awesome. And I look forward to actually hearing your voices and speaking to you going forward. So have a wonderful day. Be kind to each other and supportive and compassionate, and let us know how we can help. Take care. Bye, all.